screen. You can see the screen, yeah?
Yes.
Yeah. Perfect.
Yes, you can.
Okay,
See.
so welcome everyone. I really appreciate you taking the time to attend this, whether you are doing the course obviously or not, whether you are planning to sit the exam soon or not. This will be very beneficial for you. So obviously we are going to speak a bit about ourselves, you know, the course platform, the exam, lots of tips and tricks, you know, those sort of things. And then we usually get some people who sat the exam before to join and who did the course as well to join us and then speak about their feedback. So I've got two joining, hopefully someone in 15 minutes and someone else in about 30 minutes. So I'm going to pause in the middle once they join, and then we'll ask them a bit about their experience and, you know, ask them a bit about what they did and how they felt through the whole journey. Hopefully it won't take long, and obviously it will be recorded, so feel free to disappear whenever you wish, and then you can watch it later if you want to. Okay, so a bit about myself. So, oops, what happened? Start it again. Hold on. So I've been doing this for some time now, about a couple of years, more than a couple of years. And I really felt that it has been useful a lot for everyone. So even for me, because imagine that you're doing this very frequently. It's quite a good refresher as well, you know. So all of us forget things, and it's quite nice, I have to say. And throughout the journey, I have been making new friends. You know, I've been making lots of connections. For those who know me, I'm really approachable. I really try to help. Yeah, so even outside of the course. So it's been quite a good experience, and I hope with time that I carry on doing this for, you know, who knows how long. We started our sort of journey in about end of 23. I did the website, you know, I started off sort of very early, very small. The course was like a trial sort of thing, was for free to start with. That was during my educational fellowship at Western I. Was sort of part of my job was helping the trainees with their exam, and then I was doing this online thing for free, and I thought, you know, why not make it bigger, and why not make it a regular thing before every UK exam, and it worked quite well. I have to say, you know, I'm quite proud of what we've reached up to now. This is the website. Whoever hasn't seen it yet, we've got a YouTube channel as well. We have got, you know, different sort of social media platforms. We're on Facebook, we're on LinkedIn, Telegram, and Instagram as well. Let me get you to watch this video, and hopefully you can hear it, because last time it was not recording for some reason. So hopefully you can you can listen to it. Hopefully that's the video on the YouTube channel. Basically, it's like the intro video that we do introducing the course.
Hello, are you an ophthalmologist practicing for your oral exam? You've come to the right place. I'm Mustafa Dowidar, and this is Revise and Conquer. Revise and Conquer is an online course consisting of weekly 4-hour-long mock-ups, covering everything you need to know for the exam. One of the biggest benefits of this course is the live feedback and interactive discussions that guarantee you significant improvement in your performance through a simulated exam setting. Another great advantage is the extended time frame of the course, where you will have time to reflect on your learning and read the OSCE and Viva topics we covered. As an examiner at the Royal College of Ophthalmologists and a previous educational fellow, I've developed an immense passion for teaching and gained a lot of experience in the highest field topics and stations relevant to the exam. The course runs for 4 months and is held twice every year around January and July. You will have other flexible options, either to join for only 2 months instead, or even watch the videos recorded if you cannot attend weekly due to other commitments. As you can imagine, the course is quite intense and requires ophthalmologists who are very keen to learn and develop their knowledge and skills. Are you wondering if you can still join the course while studying for another exam other than FRCOphth? The answer is yes, as it's still the same curriculum for all ophthalmology clinical exams worldwide. We all know how stressful and tedious these exams can be sometimes, especially with our very busy schedules. That's why I'm here to help. Feel free to get in touch with me with any concerns or questions you've got. I'm happy to answer any inquiries. Thank you all for watching, and I hope to see you soon on the course. Good luck.
So I hope that worked, because last time it didn't sort of work that much. But anyway, so we have grown a lot, and I'm really proud of the sort of area that we're covering. Those are the areas and countries which basically have ophthalmologists who sit the FRCOphth exam, okay? Specifically the FRCOphth. Some are sitting the FRCS, although now it's becoming sort of old school. I think now more the direction is more towards FRCOphth, especially because it's really mandatory to go through your CSER and your portfolio pathway and stuff like that if you want to come to work in the UK. So the FRCS is becoming a bit more sort of, not that common. And obviously the main sort of areas we're covering, especially the UK, India, Pakistan, Far East, Middle East, or even, went over to the Americas. So Trinidad, again, they've got a center there, and Brazil, Argentina, the US. Mainly those sort of people are planning to come to the UK. And the RC of the college are now more interested to open more centers across the world, and they've already did in most of these countries, actually. I think there are now more than 7-8 centers across the globe. So, and they're trying to make it even bigger. So it is becoming more popular as we go. Fine. As we said, we started in 2023. We were a bit, a small bunch. By the way, I won't say all of those passed, but I'd say 90% of them passed. Okay, that was the start, and then we grew a bit more. So this was the examination and skills techniques session that we do before every exam in the UK. This one was at Western Eye, and a big shout out to Keeler, who have been really supporting us. This is Nicola there. She's the head of education in Keeler. They did a very, very big job and extreme big effort to bring their equipment, so the indirects, the direct ophthalmoscopes, all the way to Western Eye. Luckily, we had the slit lamp to use, but later on we thought, why not bring it to Keeler headquarters? So that's what we did later on. And then, as you can see, we've got a slit lamp. We sort of, I'm a bit proud of this. We attach an adapter with a phone, and then we sort of practice the illumination techniques on the slit lamp. So I'm really sort of happy with that. And as you can see, it's a hybrid session. So most of those attending, I'd say most of them were candidates in the course. Some of them were not, and lots of others online as well, okay, who obviously cannot come in person. Although I would strongly suggest you attending this session in person if you can. Usually it's the last week before the course, usually. And then we brought it to Keeler. That's in Windsor, in London, West London. And again, they've got a very good setting. They've got all the equipment there. So it was much a nicer, sort of fancier place to do this. And we've done it twice up till now at Keeler, and I'm really sort of keen on carrying on doing it, despite me moving up north to Newcastle very soon. But I will be planning to come back down to do it still at Keeler, because they've been extremely supportive. Fine. let me talk you through a bit about the exam statistics. Okay, I'm sure all of you know that there are exam reports that are published, part of the sort of GMC standards of transparency. I would suggest you reading a bit about the exam. So they tell you everything about the exam. How is it structured? How they mark people? What are the pass rates? How many people sat the exam? The pass mark, everything. Yeah. As you can see, the pass mark is usually, it's quite variable. That's one. If the candidates are quite low, like for example in Mumbai in January this year, all of them passed. Yeah, so all of the 5 candidates, and it's about passing a specific pass mark, and there's very complex algorithms they use and marking sort of methods to put that pass mark. I would say you don't have to read all the reports, obviously, but as a general rule, usually it is quite variable, but it's about from 60 to 70% pass rate, this exam, which is not too bad at all comparing to, let's say, the part 1, which was like 30% pass rate. So the exam is not that tricky, okay? But it needs someone, which we'll discuss in a bit, someone confident. Yeah, someone, you don't have to know everything, but you have to have this level of confidence and experience to convince the examiner that you know what you're doing. Okay, you don't have to be a genius. Okay, so, and you don't have to know everything. You just have to present yourself well. That's the whole key. Again, a few points I sort of summarized for you. Usually, there's about 300 candidates that sit the exam every year across the globe. It might go higher in the future. Pass rate is about 67%. That's at least the past sort of 3-4 years on average. And most people usually do better in the Viva rather than the OSCE. The Viva is, it's just some sort of topics and stuff that you study and then you forget the next day. So it's quite easy to say in the exam, yeah, tell me about this, or what would you do in this situation? So it's relatively easy. Even with new sort of stations in the exam, it will be new for everyone. So even if everyone sucks at that station, it's not a big deal because everyone sucks at it because it's quite new. The OSCE is the more tricky bit because lots of reasons, you're not practiced enough, you're not, your presentation skills is not great, you're not confident, maybe your language, there's a language barrier, for example. So there's lots of difficulties with the OSCE. So that's why usually people do better in the Viva. And again, a very common question, should I sit the exam in the UK or should I sit it back home in Pakistan or Singapore or whatever? There is no rule in this sort of thing. It doesn't matter exactly where you sit the exam. My take on this is usually for those people who are in the UK, okay, I'm sure lots of people know my opinion on this. If you practice in the UK and you go do the exam abroad, you will have that slight advantage over candidates that work there because it will show that you are working in the UK. You will know what you're talking about, especially in the Viva. The terms, the guidance, those sort of things. That being said, lots of people overseas are excellent. Okay, they do much better than UK candidates, but still, in my personal opinion, you would have that sort of advantage. Although it would be much more expensive outside of the UK. So again, you have to do the math on that sort of thing. Our course, usually, I'd say per year, about 30 to 40% of the candidates worldwide do the course, which is great. Okay, I'm really happy with that number. Given the short time span, it's only been 2 years. We've been doing this even less than 2 years. So it's been very popular, and I'm quite happy with that. That's why I'm quite keen to carry on doing it. And our pass rate is about 80%. Okay, again, something that I'm really proud of. 80%. It's better than the global rate. Yeah. And usually people do better in the OSCE from our sort of experience. And that, in my opinion, that's a good thing because that's the whole point. I think we focus more on the OSCE because that's the tricky bit of the exam. How to practice. You sort of talking a lot every week, it's quite useful. That's my sort of take-home messages. Whether you're doing this course or any other course, you need to practice. Okay, so practicing the cases and examining the patients is the most important bit of this exam. You've been examined already in the written, so we've tested you on that, but now it's time to see how you examine the patient, how you manage the cases by mouth, rather than on MCQ. I can see that Ahmed has joined us. He's one of the previous candidates. I know that he's on call, so I will ask him to unmute. Ahmed, can you hear me?
Yeah, I can hear you.
Hello. Hi.
Yes,
Thank you
me
very
too.
much for attending. Thank you very much.
That's all
Ahmed
right,
has
Ahmed.
been, he's been one of the excellent attendees in the course. He's been attending every week, I think, and he's scored magnificently well in the exam. So I think he's one of the best sort of candidates I had over the past 2 years. So
Thank you.
I'm going to ask him. I'm going
It was
to ask
really
him.
a pleasure. Thank you.
Yeah, I'm going to ask you a few sort of questions. Okay, so first of all,
Yeah, sure.
tell us about the experience as a whole. So he works in Swansea. I'm not sure how many years you've been in Swansea, but tell us the experience. What did you find the most tricky bit preparing for this exam?
Okay, so I have been working in Swansea about 3 years before the exam. Okay, this is my first job in the UK, so I have been working here in the UK for 3 years. Definitely, this exam is totally different to a lot of other exams. Like I have been in FRCS Glasgow, for example. I have been through that third part twice. I didn't pass the first time. I passed the second time. So this examination definitely is different. So being in the UK
I mean,
is a
without
big
interrupting you,
advantage.
sorry, your camera is sort of swapped other way around. You want to sort of flip it over. Yes, that's much better. Yeah. Okay, carry on.
So again, the being in the UK is a big advantage. Okay, but it's not. It doesn't mean that this is the only way to pass the exam. You need to put more effort. If you are outside the UK, you don't have the UK experience. You need to put more effort to understand the systems. Okay, but again, this doesn't mean that this is the only way to pass this exam. As definitely your course is so helpful. I'd say that it helped me a lot. Really, it was the most important part in the preparation for the exam. I
Why is
wouldn't
that? So
say
tell
it
us.
is enough.
Yeah, tell us how
You
how did it
always
help?
say that. So you always speak about that. This course wouldn't be enough without studying. You open the areas that we need to study, but this does not mean it would be enough without studying. This course helps actually in different ways. So first of them is that it gives you the chance to discuss. About myself, I know I have known previously that my knowledge wasn't bad. It was like good knowledge, but being challenged is different. Okay, so it gives you the chance to speak, which is really important. So I couldn't attend all the courses, like all the sessions. I could attend maybe about 80%, which is, I think, good attendance rate.
Yeah.
Yeah, because I still had on calls, I had theater lists on weekends, I had different commitments, which I couldn't attend every single session. But again, when I attend, I feel that I get much more benefit from the session. Okay.
Yeah.
So listening to the session is useful, but attending the session is 10 times more useful. Okay.
I agree.
So this was the first thing to say, that attendance and challenging your knowledge is a big point. Okay. Second point is that it covers most of the areas. Definitely no single course would be able to cover every single aspect in the exam. No single book would be able to cover all aspects of the exam. You need multiple sources to be able to cover everything. Okay. But definitely the most important source of them was the course, together with the blue book, which was recommended, okay, as a source of studying.
Yeah.
Again, I think if you go for these two with some clinical knowledge, application of the examination techniques before the exam for long enough time, this is a guarantee to pass. Okay. You need definitely more to say have a definite guarantee to pass. Okay. Like you need to study more than one source. my previous experience, I studied for part 2 MCQ rather than the MCQ sources as a reference book. I studied Oxford handbook.
The handbook, not the training one, the handbook one. Yeah. Okay.
The handbook. Yeah, the handbook. It's a very good source for like basic knowledge for MCQ exam and covers most of the areas for the oral exam as well. Okay, but for the oral exam, I added Kansky. I didn't revise Oxford because it was a few months before. I studied Kansky. Okay,
all of it.
The
So
advantage is,
all Kansky.
yeah,
Okay.
all of it. The advantage in that is that it gives deep knowledge. Okay, although mostly you wouldn't be digging that deep in the exam, but if the examiner goes deep with you, you have deep experience, you had deep knowledge. Okay, I think I went a bit far with that. Okay, but if you have time, you can do that. Okay, if you are
And how long?
starting early and you
How
have,
long did you? Yeah. How long did you prepare it for? I mean, is it 4 months, 5 months, 6 months?
I don't think it was 6 months. It was shorter actually, but because I studied Kansky before for the FRCS, so it wasn't my first trial with Kansky. I was revising it more or less. Okay, so maybe about 4 months, 3 to 4 months that I studied really. Okay, together with the course, I attended the course from the scratch, from the first session. If you remember, I attended with you from session number 1.
Yes.
Also, definitely, I'd say that you opened up several areas that I couldn't see before the course. I'd say that honestly.
And
Several
he
areas that
practices
I
in the
thought,
UK, by the way. So he's kind of he's got the advantage. He works in the UK, but imagine that you're working in the Far East and no idea about how we do things in the UK. Very important to. It doesn't matter if you're the best clinician out there. Yeah, knowing these things, no one can sort of can pass this exam without actually reading and knowing those sort of stations that might show up. Would you agree? Yeah.
yeah, definitely, I do agree. I do
Yeah.
agree. A lot of stations, either in the Viva or in the OSCE, but more towards the Viva day, these stations are not totally related to your practice. They are related to your knowledge about things in the UK that you wouldn't know about except if you are practicing these subspecialties and someone points these areas to you that these are important. Okay,
Yeah.
so I studied the blue book. Okay, but I couldn't really see the points that are being asked in all areas rather than Mustafa actually pointed them. This area can be asked, it is in the blue book, but I couldn't see that it is that important. It can be asked in that way. Okay.
And for those who are confused, the blue book is like a Viva and OSCE book, which I'll show you later. Yeah, I hope most people know it already, but it's quite useful. I'll talk to you a bit more about it. Yeah, so carry on.
Yeah. Also, I'd say another source which I didn't know that it is that important, but I realized how important is the GMC Good Medical Practice. It doesn't take long to, it doesn't take long to study at all. You might read it all in less than an hour.
Yeah.
But it is a very, very, very important source, which is mostly covered in the Blue Book, but you must read it as a whole separately from their website.
Yeah.
Okay. Excellent. So this is really important area. You are asked about points in it, and you are asked where is it mentioned. So you cannot answer that question from the Blue Book.
Yeah. How about your examination
when
skills? Have you? Sorry to interrupt. So how have you been practicing every week? Like when we started the course 4 months before the exam, have you been sort of making like a time frame of, okay, I'm going to practice using the direct, for example, for a few weeks, or how did you manage this?
So for the direct ophthalmoscope, I have practiced with it previously also for the FRCS. Okay, so it wasn't an experience from scratch for me. Okay, so when I came near to the exam, I thought, oh, it's important to use it again. So I started actually maybe about 1.5 months before the exam to think about the direct ophthalmoscope. Okay, yeah. So being in a clinic, you have a lot of patients. So start with dilated patients. You have patients with dilated pupils, with clear media. You can start with this type of patients. You choose a good candidate who is cooperative, who wouldn't mind that you see him in more than one technique, and then just go for checking with the direct ophthalmoscope until I think all the trick about the direct ophthalmoscope is the orientation. You know which direction you ask the patient to look at, which direction you should be coming from. When you get that point, you find it's getting fluently through smaller pupils. Then in my exam, I had a patient which I was asked to examine both eyes with the direct ophthalmoscope.
Tricky.
So,
I think that's the most tricky
yeah.
station in the OSCE.
Yeah, and he was not dilated as well.
Very tricky. Yeah.
Yeah, I'd say Mustafa knows I got really high score, which is like something I'm proud of. Yeah.
You should be.
No. I don't know whether I told that to you or not. When I went out from a couple of stations, I thought that I have failed the exam actually.
Really?
Yeah.
Why is that?
Yeah,
Why
especially
is that?
the posterior segment station. When I went out from the posterior segment station, I thought it was my second station. I thought it looks like I'm not going through that. It seems that I'd have to go through that exam again. Because my first case wasn't very nice. It was really tough case with a very difficult view to the fundus, okay? I couldn't say useful thing in the findings rather than saying that I have seen a traction band from the optic disc going temporally, okay?
Yeah.
So I thought this is not enough as finding. I ruined this whole case. The examiners are not happy. I messed up that station. Then in the next case in the same station, it was a video, and the discussion, I thought I didn't do very well, although I found out that I did well, but they were asking about something specifically that I couldn't realize what was it. Until now, I don't know what they wanted really, although they gave me good marks at the end of the day, but I didn't know what they mean by their question.
Yeah.
So the most important advice I'd give to anyone going through this exam, please forget about the previous station. At the end of the day, you might find that I have missed that station. I'm going to fail the whole exam because of that station. You still think about it, going to the next station, to the next station, to the next station, and then you find at the end of the day that you failed the exam because of the following stations. You were not giving enough concentration to that.
Yeah.
So
yeah.
I decided, this was my second station. So first station I was in was glaucoma and lid. This was my second station, posterior segment, and I was going to third station, which was orbit and strabismus, which was a bit tough as well. I had a tough examiner who is a well-known examiner. He is mask face, and he's very well known for his knowledge.
Yeah.
I thought I didn't do very well with him as well, but he scored me the highest score in the day.
Exactly. So it doesn't.
He kept asking.
Yeah. So it really doesn't matter if you not be able to answer a few questions. That's fine, as long as you convince them that you're experienced, or that you're sensible, or you didn't panic, or you know how to examine the patient. You're calm. Yeah. I think it just shows, because the examiners are very experienced, so they will know if this person knows what they're doing or not. Very experienced. You're not going to be able to fool them. So what he's saying is, even if you mess up one station, he's done very well actually, but in his point of view, he's messed it up, but actually, he got full marks. So just try and defocus out of the fact that, oh, I didn't do so well. No one's going to exit this exam saying, I'm perfect, I've done 100%. It's not going to happen. Okay, you could always do better, but it's an exam, so you'll always stress out, and it happens. How did you find the examination skill session at the end? Did it sort of summarize things, or how did you find any suggestions?
I'd
what
say,
would you?
This is an area that I would talk about also. This session is really useful, okay? But I'd say that the book about the examination technique should be introduced very early for everyone to use it during their preparation, okay?
Yeah.
So a lot of people don't know about this book. I knew about it also from FRCS Glasgow, but I didn't read that part except when you mentioned it for the examination skills.
Again,
Okay,
I'll show it to everyone. I'll show it to everyone in a bit. The yellow one, the Chua one.
Yeah. It's a few pages. It's a few pages that you need to read as well. Again, less than an hour, and you'll be covering that area that need to be read. It's short pages, about 15 or 20 short pages, really. But they are extremely important. You need to put them in your practice. So the main trick about that, when I was talking about the difficult examiner in the in the orbit and strabismus station, it is so easy to ruin your examination technique in the exam if you are not like very used to doing the examination in these steps. You will just skip some steps if you try to just remember them and do them in order only in the exam or a few times before. Definitely you will lose a lot of them, especially in a station which is seen in every single exam. I don't think anybody going through this exam wouldn't see a thyroid case.
Yes.
Thyroid case is the most common station in this exam. And it's really complex to remember everything you need to do for this case, because you need to do orbit examination, you need to do motility, you need to check for optic nerve functions, which includes the pupil. So it's a lot of things that can be examined in this station. So you need to like follow a flow chart to fill every single point in that station.
And you have to be quick as well. You know, you cannot
exactly
cover everything in a short time. So you have to be very efficient. Yeah.
Exactly. You have only 6 minutes for that case. You have 3 minutes only to do all that examination to give enough time for the discussion. So I had one thyroid case with that examiner, and he was really tough with the questions. So every one of us thinks, oh, I know everything about thyroid. Yeah, he didn't ask anything that we don't know. But at the end of the day, it's how to present these things fluently without any stop and without need to be prompted in a case like this. Okay, so you think, oh, I know everything about thyroid. Yeah, you know everything about thyroid, on the academic background. But when you see a patient, you might like drop that you would send the patient to orthoptists.
Yeah,
for example, because you are thinking about the case academically, but not like as a flow chart. When you are asked about investigations, you would think about the normal investigations you'd ask for. Oh, I think about bloods, T3, T4, TSH. I'll send for CT scan, maybe MRI. But orthoptist, you wouldn't remember it except if you see a patient in the clinic, think, oh, this is what I need to do. 1, 2, 3, 4, 5. So you need to introduce everything together, mix it up to be fluent during your exam.
And that will not come without practice. That's why it's very important, again, whether you're doing the course or not. Let's say you're not doing the course. In your day-to-day practice, you need to do this a lot, you know, so it becomes a part of, as if like driving, you know, so it becomes part of your brain memory, muscle memory. So the more you do it and time yourself, the easier it gets. You don't want to practice all of this for the first time on the day of the exam. Hence the importance of practicing. You have to get someone to give you feedback, live feedback. Just reading the case or just listening to someone speaking is not enough. You have to do it yourself. You have to speak.
I totally agree. So this is what I'm saying, that although I did know every single point I was asked about in thyroid eye disease, for example, because I know this case is very common. But at the end of the day, you might be trapped in any area there because you didn't practice enough. So you missed up like examination of the pupil or visual acuity, for example, or you missed to send the patient to orthoptist, or
something very simple, but it will lose you marks.
Yeah, exactly. It will be counted as prompting. So although you know it, they had to give you a hint to say it, so you lost a mark, which shouldn't be lost really in that area. Okay. In neuro-ophthalmology, the difficult and really difficult station, I had a case that I didn't know a diagnosis at the end. I couldn't reach a diagnosis. Still, it went fine. You don't have to reach a diagnosis. You need to be logic in discussion. You need to be logic in discussion. You need to fill everything really. They mainly test how you think, how you examine the patient, and then how you think about the findings. They are two simple questions. Did you find all the positive findings or not? And excluded all the negative findings, important negative findings or not? And the other question, how do you think about the findings that you have and how to connect them together and how to be safe with the patient?
Yeah. Very sensible. I think you've summarized actually what the rest of the talk will be, I think. So thank you very much for that. Has anyone got any questions for Ahmed? Because he's on call, so I'm sure he's going to be wanted to disappear in time soon. Any questions? And I'm sure he'll be happy to be contacted as well if necessary. Hopefully.
Yeah, sure.
Yeah, sure. Should we let him go or should we keep him with us? No questions.
Hello, Ahmed. Hello, Mustafa. I have one question, if you have time.
Please, yeah.
So my name is Ahad. You have mentioned two books. You have mentioned the Blue Book and you have mentioned the Oxford Handbook. There was a slight, I think Mustafa was mentioning the training book, the Oxford training book. What about that? Do you recommend it or not?
Do you know which one he's talking about, Ahmed?
Yeah, I know which one he's talking about.
Yeah,
the Oxford Training Handbook. The Oxford Training Handbook is, I'd say it's nice, but sometimes you'd be asked some deep questions which wouldn't be covered there at all. So, for example, I'd say two examples from my examination. So that case of the fold of the tractional band from the optic disc, which was the only trick or tip that was given to me during the examination is this eye is nearly blind from childhood. Okay, so they're talking about something congenital. And they wanted to hear the word hamartoma. This was really important to them. Okay. Another discussion about the capillary hemangioma, the retinal capillary hemangioma and its association and the MRI scanning. That depth of information wouldn't be in the handbook. The other case that was actually a case in the examination was birdshot chorioretinopathy. And we went through every single thing. Okay, so I worked sometime in uveitis clinic, so I had some knowledge about these cases. We went through everything. So from HLA testing to ERG, ERG wouldn't be mentioned in a lot of diseases, really. Like it's the only one in the uveitis area that would say ERG testing. So I was asked about that as well. So electrophysiology was important to mention here. Lines of treatment, how would you approach the lines of treatment? So it was really deep discussion. Oxford training book, I don't think it's that deep. So you need to have another source which has quite deep knowledge to be able to master most of the stations. Still, I don't say that you will be able to answer 100%. Nobody would. But the more you study, the higher you score, the better guarantee to pass. You know what I mean? So at the end of the day, I was lucky to remember the hamartoma. It can easily slip.
Very tricky case. Yeah. It's not common. Doesn't show up at all. Tricky
it can easily slip from your mind. So it's so easy to slip. But if you study from shorter source, like a smaller book, you wouldn't find it anywhere. So you wouldn't know about it. Even if they prompt you, you wouldn't know it.
Yeah. Well done. Okay.
Thank you so much.
That's fine. I think let's move on. I think some Busaraben Gandhi, you've got your hand up.
It's Bushra.
Oh, Bushra. Sorry, it says Bushra. Okay. Hi, Bushra. Go for it.
Yeah, it's okay. Ahmed, one quick question. I'm very confused about how to study about if we are studying together about OCT. So I get confused that how they are going to ask us questions on basis of investigations. So if, for example, there is an OCT of SRF, so are they going to ask of causes and how will you manage and how will you investigate like that? So because in the blue book, it's very elaborative. So are we going to mention Like if it's Cushing, I would like to do these things and that things. I mean, I'm because we will only get around 3 minutes, right? So how
No,
to study?
the investigation station is longer than that. It's like any other Viva station. So the investigation especially has enough time. Okay, I think it's 10 minutes. So basically, they can ask about anything. This is what I can say. So they can start by asking about the investigation directly. Actually, Mustafa knows that I had some different approaches in my exam. So I thought when I was reading about the exam, listening about the exam in the course, that the investigation station would start directly by a photo of some investigation. But in my examination, it was not like that. It started by a case discussion.
A clinical scenario, and then
exactly.
It's actually call it a management. My sort of suggestion is just call it a management sort of station. It's usually mainly clinical, and then maybe a couple of questions about investigations. Yeah, because again, in the past, I think they used to ask very deeply about the investigation, like its principle and its optical principle and indication, stuff like that. But actually, it's mainly clinical. So, like for example, the OCT. Talk us through this. You know, what can you see? What's your differential? How would you manage this case, for example? It's purely clinical. So obviously it differs. You know, it will differ, but there is lots of clinical cases and questions in that station. It's not just the investigation.
Yeah, in my exam, it was about B-scan. So initially, it was about just patient with floaters. So patient having floaters to go through the retinal detachment, to go through vitreous hemorrhage as differential diagnosis. So basically, they wanted to hear hemorrhagic PVD before retinal detachment. For example, you can't just go for one diagnosis, or this patient has a retinal tear and he has blah, blah, blah. Okay, so they want a differential diagnosis. You need to formulate a good differential diagnosis before they give you the photo. And after the photo, it was only one photo of B scan with incomplete PVD versus retinal detachment. Okay, so it was a bit tricky photo, and actually the questions went in both directions, more towards vitreous hemorrhage, management of vitreous hemorrhage in different situations like diabetes related, trauma related, query retinal tear related.
Very clinical questions. Yeah,
exactly. And even went deeply about the vitrectomy and consenting for vitrectomy. What would you consent the patient for vitrectomy? They were waiting for the word sympathetic ophthalmitis. So it can go that deep in an investigation station. So as you can see, it wasn't really investigations, as Mustafa says. It wasn't really about the investigation itself, but it's more like clinical scenario that has an investigation embedded in with a couple of questions about it.
yeah. And
Jazakallah.
I mean, some very very tricky investigations show up sometimes, like VEP or ERG. Sometimes, you know, sometimes it gets very tricky. OCT is very easy.
Yeah.
You know, and we'll cover all of those anyway in the course. So don't worry about investigations. I think it's a bonus station. Ijaz Haq, you've got your hand up.
Yes. I just wanted to know that in the exam, do the examiners have same set of questions to ask each candidate, or it just depends on them that they asking one candidate different questions on the same station and other candidate different questions, or they have a same set of questions for everybody and then they mark on that?
I think Mustafa would be answering that question as examiner.
Yeah, so it's definitely the same questions. Okay, so definitely they're not going to change the questions. However, that being said, let's say you're a top student, you know, you're a top clinician, you've answered everything correctly. Maybe the examiner could ask you an extra bonus question. Yeah. Let's say you've missed a clinical finding. Yeah. However, they think that you're stressed and then they want to give you a bonus mark instead. They might ask you something different. Yeah. Sometimes, although that should not be happening. It should be strictly following the set of questions that you've got. Okay. Without any, unlike other exams and other places in the globe, you know, worldwide, it's different, but this one should be very structured. One of the best things about this exam, debatably, is it being structured. Yeah. So yeah, don't worry about that as well. We'll talk a bit more about the questions in a bit. I need to get Amit to speak a bit. You remember Amit? He was one of the other candidates as well. So thank you very much, Ahmed. I
Thank you
really
very much,
appreciate it. And
thank you
please,
for
everyone,
getting me today.
he's a very nice guy. Please get in touch with him if you've got any questions. I'm sure he'd be happy to help. Okay.
Yeah, sure.
Thanks, Ahmed, and good luck with your own
Thank
call.
you.
Hopefully, you
Thank
have
you.
a quiet one.
Hope
Okay.
so. Thank you. Bye.
Okay, let's move to Amit again because I don't want to waste a lot of his time. Amit, can you hear me?
Hello. Yes. Can you hear me?
Hi. Yes, yes. Thank you very much, Ahmed. Thank you very much. Ahmed
Great.
is joining us from Sheffield, I believe.
Yes.
And again, he was one of the best candidates in the course recently. So thank you very much for joining. I'm not sure how much you've heard when we were talking with Ahmed, but more or less, I'm going to ask you similar questions. So,
Okay.
how did you find the preparation for the exam? So, how long did it take you? What was the tricky bits of that whole process?
Yeah, so I probably started about 4 months before the exam itself. I caught a little bit of what Ahmed was saying towards the end. I didn't hear what he said at the start. I'm sure he would have said it or you would have said it, and you'll hear it time and time again. The blue book is literally essential. It is so important. How much is covered within that book and the consistency, that kind of stuff does come up in the exams. I really try to focus a lot of my revision on in-person stuff. So with consultants or with fellows or people who have done the exam, I was quite lucky that I had another registrar in the department sitting the exam as well. So we did a lot of practice together. And I think that's really crucial for this exam versus everything else I've done up until this point. Exam technique is almost as important as the knowledge. Again, kind of what Ahmed was saying, it's about showing the examiner that you know what you're doing and actually being able to confidently deliver your answers, I think counts for a lot. And it actually carries a lot of goodwill, I think, in what the examiner is going to grade you as. And then being able to just go through the process of dealing with being under pressure and uncertainty, managing that uncertainty when you're very stressed out is very difficult, I think, to get by just reading or listening to whatever, as you were saying, Mustafa. So I think if I kind of think back, I was thinking back before this about doing the course and the first session that I did. So I remember like very well exactly what it was that you asked me and what the station was, because it was my first one that I was doing, and I was so nervous on the build up to it. Even though I know the revision course is a relaxed environment, right?
It's very relaxed, but it's not formal. So it
doesn't feel that way. It doesn't feel that way when you're sitting here on this side of the screen, right? And it was a normal tension glaucoma case. And thinking back now, it was a really straightforward thing. Easy questions, should have been fine. And I completely like flubbed up my answer. I said a bunch of stuff that wasn't relevant. And you said at the time as well, just take a second, think about what you're going to say the right thing. Don't just say everything that you can think of about the topic of glaucoma. Yeah. And I just said everything that I could. I'm pretty sure I had physical beads of sweat like on my forehead at the time, right? I was so nervous. But then that's probably part of my personality of going into it and actually repeatedly then week by week engaging in the sessions and being forced to present your answers, do things out loud with someone, knowing everyone else is listening, was massively important for me. And that was probably the biggest thing for me that developed my skills over the months I did this course for. And I think, the really biggest thing I'd really stress for everyone is to just put yourself out there to engage in the sessions. And again, I've done the revision course. I know what it's like. It can be easy to just sit back and listen and actually not put your hand up to say you want to do a case or not highlight that you haven't done something. Because again, for me, it just means that you don't have to deal with the pressure of it. But that's exactly what I needed to do. And being forced to do that week by week made a massive, massive difference. Good. So that was the biggest thing that I found helpful. I didn't do any other revision courses or any other mock OSCEs or anything else. I did this course and then some in real life practice. And for me, it was more than enough.
So
to get me
it's
to the point.
interesting because, again, I'm sure everyone knows that there is lots of courses out there. Without mentioning any other courses, so why did you decide to just take one course? Because I know lots of people who did more than one course, especially as trainees. I'm sure you'll get reimbursed for these courses, so you're not going to pay yourself. So
Yeah.
so why not do more than one course?
So, so from my point of view, it was the fact that this course offered the repeated exposure to having to do things myself out loud and hear how other people respond to things weekly. And I knew what the breadth of the course was going to be like. I knew that we were going to be covering lots of stuff. So I didn't feel, for me, like it would be an effective use of my time to do other courses as well. That's how I felt. You know, time is so important building up to the exam, and making the most of the time you have is so important. I guess another point alongside that is, so I took the week off before the exam as annual leave, which I think was about the right time to kind of really focus on looking at kind of guidelines and the stuff you have to memorize close to it. I wouldn't take too much time off though. I know some people who took kind of 3 or so 4 weeks off before the exam, and actually having that break from clinical work, I think is not ideal. So
Yes.
again,
Yeah.
I'm sure Ahmed said, you are really seeing the kind of stuff that you see in clinic. And actually every day, if you're taking the lessons you're learning from these sessions and thinking about, you know, say you're having a patient presenting with proptosis or whatever, and actually properly doing your orbital exam every time you see that patient, actually approaching the patients in clinic like the OSCE was what I found to be really, really useful. So I didn't feel I needed to do anything else because of what the course gave and what my day-to-day work was giving me.
Good, excellent, perfect. And how did you find the examination skill session at the end? Was it like a summary sort of thing to, you know, summarize everything that you know or practice?
Yeah.
What would you recommend to others?
Yeah, so so I found it useful, particularly being able to just do some hands-on practice with other people. So as I said, I had one registrar who was also sitting the exam that I was working a lot with in the build-up. But actually, it is useful to sit with other people, because if you do enough with one person, you can almost kind of second guess each other, right?
Yes.
And it becomes a lot more easy to kind of, you know, you can just kind of start simulating what your next step's going to be to encourage the person opposite you, especially if they're your friend. So actually doing stuff with strangers I didn't know, I found very helpful. And then just going through what all the scenarios for examination skills could be, making sure I knew what techniques you had to be ready for on the slit lamp. So for example, you know, you talked on that final session about certain techniques on the slit lamp for examining certain parts of the eye. I know someone who did the London course only, and I was talking to her afterwards. That was the registrar that I was working with, and she was like, "We didn't cover much of that side of things." So I think it gave me a good rounded balance of the skills I need to know about.
Yeah.
And there wasn't anything else that came up in my exam outside of what we had covered in the sessions.
Yeah. So again, another important question: how much do you think the course has covered? It was not going to be 100%, I'm sure.
Yeah.
But is it like 70%? Is it 90% roughly?
Yeah, I think it was 95%. Like I said, I didn't do the blue book and this course, and then Vivas with consultants where they chose the topics. That was all I did.
Okay.
So I think it did cover things pretty well.
Good.
There were, I would say, things came up in areas that perhaps weren't expected, which is important to keep in mind. So in my lid station, the patient had a ptosis, and the diagnosis ended up being a superior third nerve palsy. So they had a motility defect, which I had looked for, had to look for, and then the full lid examination. So it was a bit neuro-y.
So
which was
so that was in the lid station.
That was the lid station. And I wrote down someone else. What did someone else had? So someone else, what did they have? In their neuro station, they had a 7-year-old with Marcus Gunn jaw winking as their patient. So it was more, again, looking at how the lid was moving. So it was a bit, so again, it's about being prepared for the unexpected.
Yes, yes. And more importantly, as you mentioned, is how to deal with the unexpected. You know?
Absolutely.
You know, and that sort of uncertainty. Actually, if you look through the training curriculum, it's one of the learning outcomes, how to deal with uncertainty. they need to know that you will not panic, because
Yes.
everyone will face that sort of scenario in real life, that you have no idea what's going on, but you still have to be sensible and take it step by step and consult others. You know, that's another important point that we're going to cover as well.
Yes.
It's not a bad thing to say, I'm going to refer this patient to someone else, you know.
Yeah.
It's quite safe, actually. Fine. What other questions did I want to ask? Has anyone got any questions for Amit? And let's talk about the communication skills. So what sort of station have you got?
So I had a trainee in difficulty.
Okay. That's not too tricky.
No, it felt, to me, it felt okay. It was just, I think, a point of, you know, being empathetic, digging down, right? So I don't know how my colleague, like other people on other rotations found it, but this candidate, the actor, was rather, you know, they were quite giving for what their problem was. Being tired, the commute was an issue, etc.
Right.
But as expected, there were like 3 layers deeper than that of what their kind of core issue was. So it was just about really kind of digging in to find out what the actual problem is here, not just accepting this on surface value. I'm sure you'll say this throughout the course, and I heard you say it a number of times. If you finish your communication station with like 5 minutes left, you know you've done a bad job, and I'm sure everyone else in the room will hear this again and again.
Yes,
and you're
that
absolutely
means that
right.
you've missed,
You're absolutely right.
that you've missed something crucial.
Yes.
That doesn't sound right.
Exactly.
Okay.
So I felt like there was a fair bit of digging to get through, but you know, it's a scenario in the blue book, so I was well prepared for it. It was a scenario we'd covered in the course, so I felt prepared for it. Made the plan at the end, and it was fine. I got 3s across the board for that one.
How did you practice for the communication? So other than the course, have you done anything specific? Have you practiced with your colleague at work doing this? Okay, very important.
So for this registrar that I was working with, both in the exam, we probably met 3 or 4 times a week to do 2 or 3 hours of dedicated OSCEs, just alternating one at a time. And that was like, it was just invaluable. So we did a few sessions of just comms, and then stuff in the blue book, stuff we found online, even, you know, stuff back from we did a medical school communication OSCEs. You're applying the same principles. So we just tried to do stuff again and again and again, out loud, just again and again and again. And that for me was what I needed. And that was just that continuous repetition of doing things out loud, being slick with doing things out loud. And again, just dealing with presenting to someone else, formulating a plan in my mind with uncertainty, and then saying it, rather than just trying to read it and be like, think in my mind, what would I say? It's completely different to having to verbalize it. And that was the biggest thing for me in the prep to the exam that I found really useful.
Excellent. That's fine. I mean, I've asked all my questions. I don't think there is anything else. And I'm sure that Ahmed would be happy for people to get in touch if necessary.
No problem. No worries.
You know, honestly, I mean, people have been very useful and very helpful. So, you know, again, Ahmed, you're an ST5, aren't you, or ST6?
5, yes.
You're 5. Have you had any experience before those 5 years in ophthalmology?
So I was an optometrist beforehand.
Oh, really? Very interesting. Nice.
Very helpful is what I would say.
I'm sure. The refraction exam, I'm sure. No, very nice. Well done. Nice.
Thank you.
Fine. Okay. I mean, the reason I'm asking is lots of other people have got 20 years, 30 years of experience, and they still not feel confident. So remember, it's not, again, it's experience is very important, I'm sure, but it's just how to present yourself, basically. That's, you know, full stop. I think it's how you perform on the day, and that will come with practice, basically. Fine. Okay. Thank you very much, Amit. I really appreciate it. And thank you very much. And I hope you have a good weekend. Yeah.
Great.
Thank you.
Thank you. You too.
Fine.
Good luck, everyone. Bye.
Thanks. Bye. Right. Let's finish off. Let's carry on. And obviously, if anyone has got any further questions, let me know. Fine. Okay. Where were we? We've done this. So let's talk a bit about the exam in detail. So most people are doing the FRCOphth, but others are doing the FRCS. Okay. Now remember that these exams are more or less the same syllabus and curriculum. It's ophthalmology, yeah. But it's a different structure, you know, it's different setup during the exam, and obviously different ways how to use that exam later. In the UK, again, in a nutshell, if you're going to come to the UK, just do the FRCOphth. Okay, the FRCS, yes, it will get you to be GMC registered, but the FRCOphth would be the thing that they sort of recognize on your CV, and for Caesar, for example, that has to be the FRCOphth. Okay, out of the question. So for the oral, as we said, it's split into Viva and OSCE, and there's a few stations that you can see there. Separate days, obviously. Most people do well in the Viva, but not the OSCE, because again, for lots of reasons, they haven't practiced enough, or they haven't sort of done a course or whatever. And the communication skills, station 6, is actually not done on the OSCE day, it's done on the Viva day. I'm not sure why, don't ask me, but that's how things are. But it's still considered as an OSCE station. I would strongly suggest you reading about the exam, okay? You have to read, you have to educate yourself on the exam sort of structure. They've got lots of guidance there, lots of sources, lots of instructions, all of that is on the website. You have to read, and as you can see, it's quite new as well. So I'd really suggest reading through that, okay? The FRCS Glasgow is the second most popular exam. Again, it's quite similar, split oral and clinical examination. It's more or less the same, but with the FRCS, they focus a bit more on general medicine. So as you can see here in the order, there's a general medicine station, like, in an ophthalmology setting. So a patient who walked in, and then they've put their chin on the sit lamp, and then they fell on the floor. So like a vasovagal attack, what would you do? Something like that. Hemorrhage, whatever. And then they ask a few questions. That's the slightly annoying bit about the FRCS, which is thankfully not present in the FRCOphth. But I've got one session dedicated for that, recorded session. So again, whoever is going to decide and join the course and doing the FRCS exam, I'll be happy to send them that session to watch. Again, just covering a few cases, which should be helpful. But more or less the same. Again, the FRCS Edinburgh, which is the least popular exam, because it has stopped at some point and then they reinstated it. But anyway, the same concept and the same syllabus. Okay, so the course that we do will help in any of those. Okay, although the structure is following the FRCOphth sort of setting. So how are you assessed? Okay, so obviously in the exam, you're sitting there on the side of the table. There is 2 examiners usually. Imagine this is a Viva station, yeah? The Viva station is, there is no patients, and it's usually a photo. Okay, so an iPad, they've got an iPad, you've got an iPad, they show you photos, they show you a scenario, and they start asking questions. There's no videos. Okay, so the Viva, there's no videos, no patients, just photographs. Okay, sometimes there's an observer examiner who's going to examine next time, so they need to train, or there is sometimes an assessor who's assessing the examiners. Okay, so and they're marking the examiners. So again, be mindful that the examiners themselves need to do well to be able to stay as examiners. Okay, but anyway, this is the Viva again on the iPad. As you can see, there is a few marks per station. Each station is usually divided into 4 sections, 1, 2, 3, 4. Basically, a section means a couple of questions. Okay, and then for each section, they ask you a few questions. Then, depending on your answer, they will give you a mark. It's not that strict. Okay, so it will happen that you will say everything in mark 3, but then they still give you a 1. Okay. However, it's very important to not take that personally. Okay, so some examiners are a bit tough, and as long as that examiner is doing the same for everyone, then that's fine, more or less. We used to be trained to write down the feedback. So if I'm going to give you a 1 out of 3, I need to write down why. I need to justify, because if you turn up and do an appeal, pay money, and then say, oh, it's not a fair mark, you need to have a reason why. Yeah. So in my opinion, you haven't mentioned this and this, that's why I gave you a 1. If I'm giving you a 3, usually examiners don't bother writing anything up in the feedback. They just leave it empty or say good knowledge or good technique, whatever. And that's it. But when we give you a 1 or 2, then I need to mention why I given you a 1 or 2. there are 2 examiners, so usually both examiners should have maximum of a difference of 2 between the marks. So one examiner gave you a 3, the other examiner cannot give you a 0. Yeah, in that particular question, not the whole exam, not the whole case, just that particular question. So what happens is you walk out of the door, and then we have a chat, and then say, but Mustafa has mentioned this. No, he didn't mention it. I don't think so. He missed this bit. That's why I give him a 0. No, but actually he did well in the examination, so please give him a 1 instead. Okay, that's fine. I'll give him 1. So we try and reach a middle ground. Okay. So that's the usual sort of thing that happens usually. And then the same goes for each section. That's the Viva. Okay. As you can see again at the top, there is a clear fail, borderline, or clear pass. If you score 1 in all questions, the examiners might still give you a clear pass. Okay, so a clear pass, borderline, clear fail, that's just like a general idea about that candidate. There's no marks in this one. Yeah. If you mark 3 out of the all questions, you can still get a borderline. That doesn't mean that you will fail. Or it's mainly the marks. Okay, and if I remember correctly, the Viva station, each station is out of 24 marks, because 3 marks in 4 sections, that's 12 per examiner. So 12 times 2, that's 24. The OSCE is 36. OSCE has got a better sort of mark weight. This is the OSCE. Again, similar sort of setting. Obviously, there are patients. There is no rules. You can get 2 patients. You can get 3 patients. You can get all videos. Happens sometimes, especially out of the UK if they couldn't find any patients. But it's usually videos, not photos. Okay. The videos are usually okay. Sometimes they're rubbish. Although now they're employing people who I know who are very, very experienced in taking videos on the sit lamp and fancy sort of cameras and stuff like that. So the quality of the videos are getting better, not worse. Okay, so that's a good thing. That doesn't mean the cases are easier, but the quality is better. So that's quite good. But we usually what, from my experience, is we used to get more patients rather than videos, because getting patients to the exam is tricky. They come all the way, so we try to use them when we can. If for whatever reason we cannot use the patient, then we'd use the video. Okay. And then, as you can see, it's again split into 2 bits. First bit is the examination, which is the most important bit in my opinion. And the second bit is the diagnosis and management. Okay. Now, this is patient 1, and this is patient 2. Sorry, the patient 1 the same, but the next bit of the question, and they give you separate marks. Remember that if you suck at examining the patient, let's say you cannot use a sit lamp, they'll give you a 0. Okay. In the next question, they will tell you, okay, leave the patient alone. This patient has got Fuchs dystrophy. Okay. Please tell me, how will you manage this patient? Or this patient is going for cataract surgery. What would you do for this patient? Whatever. If you answer your question perfectly in the management, okay, they should technically give you a 3 in this question. 0 in this, but 3 in this. That doesn't happen. Okay. For one reason is I've lost confidence in you. Yeah. How can I pass this person who was not able to use the sit lamp? Theoretically, this should not happen. I mean, because these are 2 separate ones. But remember, examiners are humans, so they get influenced easily or biased. So how can I give you a 3 out of 3 and match you up with your other colleague who is perfect in examining and perfect in managing? It's not fair. So you have to leave a good impression to start with. So you have to examine. That's the ABC. So you have to examine properly, be able to pick up the findings very quickly, very confidently. And then if you miss 1 or 2 things, that's fine. Even in the management, let's say you're not able to come up with a diagnosis, like what Ahmed was saying, that he was not able to, but with his sort of technique and confidence and his sensible approach, he got 3 out of 3. That's fine. So remember that you don't have to answer everything, but there is some stuff that you cannot miss. You cannot miss, I don't know, a corneal scar, for example. You cannot miss detecting that this patient is pseudophakic. That would be a -2, on the spot. So just be mindful of what you're doing, especially examining the patient. You have to be very confident examining. That's why people who are very early in their career, you have to be a bit careful when you're sitting these exams. You have to have the enough confidence and experience. Source of study, that's what we're going to speak about. Now, textbooks, course handouts, which we send with the course, basically, it's a Word document split into Viva and OSCE. The OSCE are the cases that we've done. The Viva are the Viva topics that we discussed, and with the sources. So if that sort of particular Viva topic is about a specific college guideline, then I'll usually copy paste the guideline and put it in that handout, so you have everything in one source. That's quite useful. The guidelines are usually the college, NICE guidelines, GMC guidelines, and the clinical trials. Okay, these are the two books that are your go-to ones. That's the blue book we talk about. I'm not sure why I called it the blue book, but because it's blue. Okay, so I think they should name it sort of a shorter name. This one is quite good, very relevant, although it's a bit outdated, unfortunately. So the guidelines are a bit outdated, and there is some updates. So if you go to revise from this book, you have to make sure that you're referring to the actual up-to-date guidelines. So if it says FRCOphth Guidelines 2018, go to the website, open the college website, and make sure it's the most up-to-date one, because it could be updated. So you have to go with the updated one, obviously. But it's very relevant to the exam. This one, the yellow one, that's the one that we're talking about the examination techniques. It's split again into two bits. The first sort of 20 pages are the examination techniques per technique. And we follow that in the session that we do at the end. Very straightforward. You can supplement that one with Oxford Handbook. Remember that there will be some mild differences in techniques, which is fine. Remember that, we all do things differently. That examiner might do something differently than this examiner. You might do something that is very obvious in the book. However, he sort of, what the hell are you doing? He just finds it strange and might mark you down for it. But that's fine, as long as you follow a certain way of doing things. All right. So there is always going to be some discrepancy. But I'd strongly suggest following that one. Oxford Handbook. There's the training one, as we mentioned as well, although I'd suggest, this is the training one on the right, I'd suggest following the Oxford Handbook. I think that's the go-to one. And Kansky, obviously. Kansky is huge. So again, I'm admired by Ahmed, who mentioned that he's covered everything in Kansky before the exam. I don't think you need to do that. But I'd suggest focusing on the cases that we do through the course and then just reading well about it. Do not cover everything. Let's say the white dot syndromes. He mentioned birdshot, which comes up a lot. PIC for sorry, so punctured inner choroidopathy, that again comes up a lot. So maybe 2 or 3 of the white dot syndromes are enough. You're not going to be asked about the others, unlikely. Okay, so just focus on what's important, I think, and what's common in clinical practice. I'm sure there's lots of books about clinical trials out there. Be mindful that, again, they will be outdated, because again, trials are always renewed, so you have to be up to date. There are a couple of websites as well that show landmark trials. Trials are always a debatable point whether you should read all the trials. I remember reading like 100 trials before the exam, which was a total waste of time. Remember that there is a station for the FRCOphth about the audit and evidence-based medicine and studies and stuff. Unlikely they will ask you about a specific trial in depth. Unlikely. Okay. The usual question is, again, a scenario, and then can you tell me about an evidence? Have you got evidence of what you're saying, or what trial has shown this? Tell me about the trial. I mean, what sort of medication have we compared, and what did it show, for example? Just very broad lines. You don't have to go in depth, because you won't be able to cover everything. Okay, you will definitely forget. So just the broad lines in the landmark trials, so the glaucoma, medical retina, the optic neuritis treatment trial, those sort of bulky ones. Thyroid, the UGOGO trials, where the UGO guidelines, for example, those sort of things. The NICE guidelines, again, and the college on the right. There's lots of guidelines there. we will cover the most important ones. That doesn't mean that you might not ask about something else. So I would suggest the more you know, the better. It's always nice, again, in your answer, not just in that sort of audit Viva station and evidence-based station, you might get more marks if you say, let's say in the OSCE station, glaucoma case, oh, according to the light trial, I'm going to offer this patient SLT. Or according to the NICE guidelines, I'm going to offer them latanoprost drops, something like that. So it's always nice to incorporate your answer, trials in your answer and evidence. Where can we get the Chua book from? I'm not sure if someone can share it on that chat. Someone is asking the Chua one, or on WhatsApp. I mean, just get in touch with me. I can send it on your. I think I've got it as PDF. If someone can share it on the chat or on the group or something, that would be nice. Fine. And the good medical practice, very important. Again, there is lots of stations in the Viva about attitudes and ethics and good clinical practice. All of these topics will be mentioned in the Blue Book, and we will cover them in the course. And then I usually sort of guide you towards that guidance. Do not expect me to go through all the guidance with you. My job is to tell you that this thing exists and that it shows up in the exam sometimes. So please go on your own time and read it. We're not going to go through all of it, just the important points, okay? But very important. If you're going to practice in the UK, this is a very important source, GMC guidelines. Okay, so a bit about a to-do list, okay? So things that you need to do, all right, before doing the exam. You have to be prepared, okay? On the day, you have to sleep well, you have to be calm, go in good time, dress appropriately. Do not go with a lab coat. I've seen one candidate do that with a white coat. We don't do that in the UK. That will do not make yourself stand out. Yeah, just be casual. All right. So like a semi-formal, shirt or whatever. And for ladies, obviously, you have to dress sort of formally. Yeah, not something very casual, not something very Anyway, you have to get previous feedback. Very important. And ideally, you should get them to test you as well, if they can, especially if they're examiners. So that would be a big bonus. If you're in a place where there is examiners, you have to get them to, as Amit was saying, practicing with consultants or examiners, and then they assess what he's doing in the clinic. Very, very important. Again, just focus on what's important. No one's going to care about the rarest sort of disease and how much you know about it, especially if you're a specialist in that area. You don't need to go in real depth. Okay, actually, that's a very big mistake, in my opinion, when you challenge the examiner. Yeah, so remember, he's a VR specialist, you're a VR specialist. If you go too deep, he will know that you do VR, and avoid that clash. Okay, and then we'll discuss that in a second. You have to listen. Okay, do not go off topic, because if you go off topic, you're losing marks because you're losing time. Okay, so you just have to answer what they're asking. Some examiners will guide you back towards the correct sort of side of things, but others won't. Okay, so some examiners just wandering into the horizon, yeah, and just wasting time. So you have to make sure that you're saying what is necessary, nothing more. Okay, you have to. That's the whole point, especially in the OSCE. There's no time. The Viva is okay-ish, but the OSCE, you don't have time at all. Maybe like 6 minutes per case or something. You have to just focus on what is necessary. If you don't know the answer, just say, I don't know. Okay, and then they will tell you the answer and then jump to the next question quickly. You have to be confident. Okay, the whole, I'm sure you've seen that before. I mean, with other colleagues or consultants, you just know if this patient, if that person is confident or not of what they're saying. Okay, so maintaining eye contact, be nice, smiling, staying calm, all of these sort of body language sort of things would really, really matter in the exam. Trust me, that really works. Okay, because we're humans, so these things will matter. Again, part of the tricking, let's call it tricking the examiner, saying that you know, or proving that you can do this on your own, or that you're confident enough, you always say, I personally do it this way. Or, you know, in my practice, we usually have this sort of guideline, even if you're lying. Okay, so I want you to lie. That's fine, as long as it's a white lie and, you know, no one's going to know. We have no idea who you are or where you practice or what's your experience. We have no clue. Okay, unless the examiner knows you and you work with them. But otherwise, they have no idea who you are or where you work. So you can say, we do this that way, and as long as it's safe and sensible, and you know, so it's always good to put that in your answers. You know, I personally do it this way, for example. Sometimes it helps. So you have to think. Okay, avoid rushing. I've got this in me, unfortunately, that I rush a bit. I need to learn how to sort of pause for a second and then think about what I'm going to say and say it in a structured way. It's never, especially you always get this in surgery. When a complication happens, you have to pause. Yeah, pause, take a breath, and then think of what you're going to do, and then manage. Yeah, it's similar. Rushing is never a good idea, whether in the exam or in clinic or in theater. You know, it's never a good idea. So being structured is very important. We really like structure in the exam. You know, following a surgical sieve. So, oh, what's your differential? It could be traumatic. It could be hereditary. It could be inflammatory. It could be infectious. Blah blah blah. So it's nice to have a structured answer. Quick and efficient, as I've said, you know, you want to progress the questions quickly because you might not know the diagnosis, but you know how to manage it very well. Yeah. So yes, you might get a -1, for example, because you missed the diagnosis, but who cares? You'll do the management very well, so you'll pass the station. You just have to pass. That's all. Remember that the examiner as well wants to give you marks. You know, despite that being sort of debatable as well, some people think that the examiner is, you know, wants to, you know, harm you in whatever way. That's not the case. They want to help you usually. So, and they want to progress to the questions, because if that examiner does not cover all the questions and most of the stations, that means that he's not a good examiner. And the assessor from the college will note that down. Okay. So it's in everyone's interest to go through all the questions and cover everything. All right. So you have to be quick. All right. A bit more about what to do in the exam. Patient safety. Again, the question is, are you a safe consultant or not? It's okay, you know, to say I'm going to get some help. You don't have to know everything, but when it's out of your expertise, you should seek help. Again, that's part of the curriculum. For trainees out there who's listening, it's part of the curriculum to seek help, yeah, or to know your limits. Do not say I'm going to consult my consultant, because you are the consultant. Okay, so now you're in the exam, you're a consultant. Okay, you're at a general consultant level, junior general consultant level. Okay, you'll say, hey, I'm going to consult my other colleague or my glaucoma surgeon colleague, or you know, whoever. Very important. So UK guidelines and protocols, obviously, always sort of say, according to this guideline, I'm going to do this. And remember that, you know, if it's a clinical one, it would be a nice guideline or a college guideline. Everything has got guidelines. Okay, so the UK is all about guidelines. So you always say, according to this guideline, I'm going to do this. All right, and obviously don't forget about the GMC guidelines as well. Amit was saying that in the course we cover 95%. I think that's too much, but let's say about 90%, 90 to 100 roughly. There is always going to be new stuff in the exam. Remember that every year they set up a workshop for the examiners to attend and make up questions. Okay, so this is a bank, and any examiner can make up a question. In the Viva, I'm talking about the Viva, because these are set up before the exam, so earlier, and then it's edited and reviewed and whatever, and then put in the bank, whether it's whatever station it is, with photos and everything, and then we use it in the exam. The OSCE, on the other hand, the questions are made up on the day. Okay, so we see the videos on the day, we see the patients, and then we come up with the questions as a group. So like a few glaucoma consultants who are examining it this day, and then they come up with the questions, and it's written down on the iPad and shared with everyone, and that's it. But the Viva is different. The Viva are renewed. Again, a very important point to stay up to date, because anything hot, let's say, you know, a hot topic, that could show up very easily. Let's say immediate bilateral cataract surgery, for example. Yeah, that's a hot topic. It's more common in the UK now, so it might be a very good common question in the Viva. So you need to be updated. Any new guideline, any new report, like the NOD data, so National Ophthalmology Database in the UK, like the AMD report, for example. This is an annual thing. The cataract report annually. You have to be up to date. Okay. Remember, in the exam, you need to be prepared not to panic. Okay, so you will face something that you've never heard about. You have to be sensible. You have to be calm. You have to be safe. And remember, if you don't know it, then just say, "I'm not sure. I don't know." And they will keep asking you less prompting. Yes, there's prompting, minus marks, because your colleague might just next door and might not need prompting. However, you can still pass the station very easily, despite you not knowing everything. Just keeping calm. That's the most important thing. We've mentioned trials. Okay, so I'm not going to go through that at all, but do not waste too much time on knowing all the trials. Okay, practicing, super important. I'd say the indirect is not too bad. Most of us know how to use the indirect. It's the direct ophthalmoscope, which everyone fails to use. I think it's a useless machine, to be honest. No one uses it in ophthalmology anymore, only on your on-call or whatever. But it's still being asked in the exam, and you need to know how to use it. So a newly appointed general consultant ophthalmologist. Okay, we don't know who you are. I don't care if you're the best person in your country. If you do not know how to manage general stuff well, you're not going to pass. Okay, because remember, this is a general ophthalmologist who are going to be covering on-call rotas. So I need to know that the patients are safe in your hands. Corneal ulcers, trauma, GCA, you know, retroorbital hemorrhage, high pressures, angle closure, those sort of emergency stuff, general stuff, you need to know how to manage properly. And the big question is, can I trust this person to join me in my unit to manage my patients or not? Okay, that's the question you need to ask yourself before sitting this exam. Things to avoid, okay, which is more important. Red flags. So I'm sure you've heard of red flags. A red flag is basically a crucial part that is missing in your knowledge. Okay, so missing a blinding disease, endophthalmitis or GCA. So what happens is, for trainees, if the examiner red flags you, the examination committee will send an email to your educational supervisor in your unit. Even if you pass, you can still pass, by the way. Which doesn't mean that you failed. And you don't know, by the way, so you wouldn't know on the day that you've had a red flag, but later on, the education supervisor should know that you're missing this crucial bit in your knowledge, and then they will bring it up in your annual ARCP or your assessment or appraisal or whatever to discuss it. Hitting the patient's nose with the slit lamp. I've got a big nose, you know, so it might happen to me, but in a professional sort of way, you should not be. You should just back off a bit and then go to the other eye. Avoid hitting the patient nose. Avoid the very bright light. Yeah, that will lose you marks. Okay, and it just shows that you don't do this often, or you're stumbled or not confident. So just be mindful of these things. Very important. Okay. Do not waste too much time. Yes, looking for the hand gel is important, but who cares? Yeah, who cares? In the exam, you just go straight to the point. Being too nice, again, that's a waste of time. You should have that sort of approach of, okay, hello, good morning. My name is Mustafa. Would you mind if I examine your eyes? And just please let me know if it's uncomfortable. That's it. Yeah. Stay to the point. Do not argue with the examiner. It's a big no, especially if you're very senior in that subspecialty. Sometimes it happens that you are a specialist, a very senior person in that unit, and then the consultant in front of you works. Actually, sometimes it's not a consultant, you know, it could be a fellow, or it could be a specialty doctor. Actually, you are training them. Do not argue with the examiner, okay? This is a very, very important point. Whatever they say will go, all right? I'm sure everyone will agree that we do things differently, different opinions, different guidelines, different way of doing things. It doesn't matter. So this is out of the exam. In the exam, if that examiner is telling you that this is diagnosis, then it is diagnosis. If they're trying to prompt you and help you, then listen to the clues. Okay, so please, can you have another look? Look at the other eye. Can you have a look at the endothelium if you don't mind? Are you sure? These sort of clues are extremely important. They're just guiding you towards the right way. They're helping you. Okay, so just listen to the clues. Do not, you know, do not say anything stupid. All right, so you know, just raising the brow, just what the hell are they doing? They have no idea what they're doing. Yeah, so so avoid that. And remember, it's an act. You just need to convince me that, okay, you do this on a day-to-day basis. You know what you're doing, so I'm going to give you the full marks, despite what you say. Okay, so it happens. Do not make things up. Okay, so if there is a sign there, say it. If you can't see anything, do not make it up. You'll be very lucky if you make up a sign and it's correct. And the common sort of scenario is the direct ophthalmoscope, when you're trying to look at the disc and you have no clue where the disc is, and just give it a, you know, oh, I can see the disc, it's pale. And you have no idea. You can't even see any view. So you would be lucky if you go through it, but if you get away with it, but I'd strongly suggest not to. I think the better option is to say, sorry, I cannot get a view. Yeah. Then they will prompt you. I think being honest is better. That's my opinion. Again, avoiding panicking in the communication skills. Okay, so remember the communication skills, these are actors. They're very experienced. Okay, so they might have been doing this for years, and they will be advised and instructed to stress you out. Yeah, so dealing with the angry examiner, angry patient, you know, they're shouting at you, or, you know, they're very aggressive. Have to be calm, you know, professional. Avoid laughing. Sometimes people smile. Yeah, so when the examiner is, or the actor is shouting at them, they just smile in a weird sort of way, and and the actor says, "What the hell are you smiling about? Is this funny? Is this supposed to be funny?" For example, and then you're in that situation where you're really panicky. Yeah, so avoid that. Just be calm and professional. Yeah, but we will cover all of these sort of sessions and skills, but it's just something that you have to deal with. You have to practice a lot. Okay, it's not something that everyone has got, unfortunately. And again, if you don't do well in one station, you can always do better in others. Remember, if you fail in one station, you can always pass still. Okay, so it doesn't matter if you fail in one, others can compensate. And I'm not sure if I've mentioned this before, but if you fail in the Viva, you can still pass the exam. Okay, because the OSCE has got the higher weight. So if you pass the OSCE well, and the Viva you fail with a few marks, you can still pass, but not the other way around. Okay, so you have to pass the Viva. So you have to pass the OSCE. Very important. Let's talk a bit about the course a bit more. So as we mentioned before, this is a weekly sort of how much is the comms? Himali is asking. The comms, I think was it 24? I can't remember now, because it's in the Viva, but it's actually considered as an OSCE. I think it's 36 actually, because it's an OSCE station. I'll need to check that again, but I think it's 36 if I remember correctly. 18? Oh, Ahmed is saying 18. Yeah, he knows better than me, so I'm not sure. 18 marks. Again, again, we'll cover that, but it's split into specific domains, like information delivery. There is a few sort of domains. I need to revise that, but there's a few domains they need to give you marks on. Yeah, and remember, in the communication skills station, there is a say to the actor as well. So if the examiners give you full marks, but then the actor says, "I'm not happy. I think he didn't do well, maybe I'm not comfortable with what he said. He ignored what I was saying. He was not passionate. He was not sort of, comforting or whatever. You might fail. Okay, so you have to focus on the actor, not the examiners. The examiners do not speak a word. Okay, so it's all about the actor. So the good thing about this course is that it's a weekly sort of mock exam, a full mock exam. It's 4 hours, so it's a lot. Okay, so imagine every weekend you're doing 4 hours, sometimes more, 4.5 hours. I remember sometimes we reach 5 hours, and we cover everything. So exactly like the exam, all the OSCE stations and the Viva stations, as in the exam. And in my experience, usually about 50-ish people join the course every round, and from 20 to 30 people attend every week, right? So if you do the math, you would guarantee to do one case or one station every week, okay? So by the end of the course, I keep a note. So I know that this person has done this case before. So I usually tend to get them to do another case. So by the end of the course, by the end of the 4 months, you would have done everything. So you would have a chance to explore all the stations. And again, part of the flexibility of the course is that you sort of, you can just let me know if you want to do a specific case. Yeah. I think I'm weak on comms. Please, can I do comms next time, for example? Yeah. It's all online. It's on MS Teams. We usually do it early on UK time. So usually it's a Sunday. Sometimes it's Saturdays, because sometimes I'm on call or I've got other commitments. So, but usually it's a Sunday, and in my experience, most people would prefer Sundays, because we used to vote. So we vote on every week. What sort of day would you prefer, Saturday or Sunday? What time? And it's just a waste of time. Most people choose a Sunday anyway. And the earlier the better. Again, we've got other stuff to do during the day, so we usually tend to start at 8 if we can. But we can be flexible. We can start at 9. I think the first time, which is next week, next Sunday, we'll probably make it at 10, probably. Only this week, only this first week, at Sunday at 10. But then later on, we'll probably be at 8 and 9 and stuff like that. Yeah. Obviously, it's from the comfort of your home, which is great. You can access it from wherever. This is me, every weekend. So ignore the bottom part. But the good thing about it is it's just quite flexible. Okay, and remember, I would suggest you participating. Okay, but if you don't want to, that's fine. If I call out your name and you don't answer, that's fine. It's your loss. Yeah. But if you're walking in the street, if you're in the gym, if you're in the supermarket, I don't care, as long as you've got your earphones with you and you're listening to what we're discussing. Okay. And as I said, this is the last week before the exam. It's a hybrid sort of session. Most people tend to attend it in person, but then some others attend it online, which is fine. Although obviously I would suggest you attending in person, because that's how you sort of practice and we comment. And it's again in a mock exam sort of setting. So we have 2 chairs at the front, and we put them in that stress of as in the exam. So please just examine this patient's pupils, if you don't mind, and then we walk you through it and discuss the questions and stuff like that. And we do the slit lamp techniques as well, so it's quite useful. And this is part of the course. Okay, so if you're going to purchase the whole course, this is part of it. It's not going to be an extra. But for those who are not on the course, they can still join, but this is for an extra fee, sort of on the side. Yeah, but this would be for free for those who are on the course already. So why am I proud of what we're doing? Yeah, so why do we stand out? I think the versatility of it. So it's quite flexible. Yeah, so as you can see, it's live, but it's recorded as well. We vote sometimes for the time to suit everyone. The problem with that is with the time difference across the globe, people who struggle are usually the ones in the Americas. Yeah, because in the UK, if it's 8 a.m., then the Far East, it would be midday, so 2 p.m. or whatever. That's fine. But in the Americas, that would be very early in the morning, like 5 a.m. That being said, I know a few candidates who were very keen on attending every weekend. Okay, they've sat the exam before, they couldn't pass, so they were very keen. And that's the attitude I'd like to see. You have to be keen, and the more you commit, the much better you're going to perform. That's the rule. There is a one-to-one mock exam as well. Let's say you can't be bothered doing the weekly sort of course. That's fine. At the end, there is an option of signing up for just one-to-one mock exam on the online still. I've got a few of those, and then just to test your performance before your exam. So separate. That's an option. Other people get the course recorded, which is an option, and then do the one-to-one. So there's lots of options. The length of it. So you will not find any other course that spreads out the material as we do. Okay, so 4 months, every week, you've got a whole length of 16 weeks to reflect on what you do and to improve your technique and those sort of things. You will not find this anywhere else. The crash course sort of thing, 2 days or 4 days, I don't think it's enough. Okay, it's okay. Other courses are brilliant. I've done courses myself when I was doing the exam, but I think it could be better. And hopefully, I hope that I carry on doing this. Imagine this takes a lot of my time, and my wife is not that impressed, but I really like doing it. So it's a good investment, and I hope I would carry on. Community. What about community means? At the end, you get a sense of the people around you. You get to know people who are with you in the course, and then what usually happens is that they set up different study groups, different countries. They meet each other, and it's quite nice, especially in the one-to-one sort of in the face-to-face examination skill session. People get to know each other, and it's quite a good sense of what was the feedback I got? Being comrades. You'll find it in the feedback later when I show you, but it's a sense of being friends, and we're all in the same boat. Yeah, so it's quite nice in that way. The other thing is affordability. I'm not going to talk about prices now at all. You can look at that online. These courses are not cheap, okay, especially if you're out of the UK. This is not cheap. However, this is the only course that will give you lots of material for an okay-ish price. Yeah, the same price you'll get elsewhere with much less material. Okay, so this is out of the question. This is just by simple math. Okay, I do have the option of financing. It's not financing, but just splitting. So you can have the option of joining the course for only 2 months if you wish, and then you can extend if you need to. Which is okay, I don't mind. And this just makes it easier a bit, just to split the course, sometimes just because of affordability. And I'm not sure if that's an option available to other courses. Accessibility. So again, as we said, it's online. You can watch it later. The access is open throughout the course until your exam. There's a WhatsApp group that we do privately, and then we discuss anything, questions, any debates, anything like that, new guidelines, sources of study, whatever. Being approachable. So again, for those who know me, I'm really approachable on WhatsApp. So let's say you've got a private question, you can always text me and then we can discuss. You will not find this elsewhere. Okay, so for any other course, you're going to attend this course 3 days and then goodbye. Yeah, you will not be able to reach those examiners or those sort of tutors. Very tricky. But for me, it's like a long-term relationship. Yeah, let's call it that. And then I do offer the option of discussing your feedback. Let's say you don't pass the exam. I always sort of tend to encourage people to call me, and then we can discuss their feedback and work on it and see what sort of could be missing and how to improve. It being practical as well, so it's very exam oriented. Some other courses are either very general or very specialized, so you don't need that in the exam. You just need the proper questions and the proper answers. They just the to the point. Yeah, so it's exam oriented. That's the thing that you need. If you want more knowledge about that particular specialty, you can do another course. but not for the exam. It being interactive, that's the top most important thing about this course. Practice, again, it's weekly. You'll not get that anywhere. Practice a lot. Again, in other courses, there is mock settings as well in other courses, but you might not get the chance to participate at all because it's 1 day or 2 days or whatever. But with this one, with the 16 weeks, you guarantee that you'll definitely get a chance to give it a go. Live feedback, whether it's in front of everyone, which is really recommended. And it's not just about you, it's you listening to others. So listening to others' mistakes and just reflecting on saying, oh, she should have said that, or he missed that point. I'm not going to miss that point. Very important. Being updated, again, you know, again, from my sort of connections and my sort of, I know lots of people, so I always get to know the up-to-date cases and stations that show up, and then we always try to update the course as much as we can to reflect on that. You get a certificate of attendance at the end, which for those who live in the UK and work in the UK, you can claim study budget from. You just use the receipt that you receive when you sign up, and with the course certificate, and then you sort of get reimbursed. So it's quite useful. I'm not sure about overseas though. I think some overseas sort of places can offer that, but not everyone. Fine. Okay. So what's new? Again, you know, we try to be personalized. So it's not just feedback general. I usually try to get in touch with everyone and discuss what they're missing or what could they do better, or their approach usually to answering the questions. So that's the good thing about it. As I said, you know, we get this sort of personal, and we work on how to do better. Yeah. At the end of the course, we try to be more time restricted and work in an exam or environment. So at the beginning, yes, it's a bit, you know, there's teaching, and it's a bit more flexible, but at the end, we try to be very time specific, because that's one of the negative feedbacks that we've got, that, you know, it's taking too long, it's too much, it's exhausting. So we try and make it as short as we can. And then more recently, last year or so, we added a specific neurostrabismus mock exam, 20 cases, which is important, super important, because this is the most tricky station in the exam. I think it's mock exam 11, if I remember correctly. So I strongly suggest attending that one. And there's a summary session at the end. So it just covers what we've got through the course, the sessions that we did not cover. So some stations and cases that we didn't have the time to cover. So again, we go through those. That will be mentioned in the summary session at the end. Some feedback. Okay, so obviously, again, this is a bit old. This was last year or something, so I need to update that a bit. But I'll take you through a bit about what people have said. The spaced repetition about over months, as opposed to crash course. We've mentioned that. Being focused, non-didactic. Yeah, so it's interactive, constructive feedback, approachable, being able to reach out personally. Okay, something that I'm really proud of, but my wife isn't. So it's lots of wasted time. I won't say wasted, but there's this bit that I spend lots of time with you as a side. Not even, you know, not just with the people in the course. It's just as a general rule. Yeah, I tend to help as much as I can. It's tailored to the exam. It's weekly consistency. It's discussions. Although the discussions sometimes are too long, and then the course, the time is quite long. So we try and make it as, you know, limited as possible. Especially, so number 7 is an overseas candidate. So I know how tricky it is sometimes, but it just walks you through the exam and prepares you as if you're working in the UK. Okay. It's comprehensive. It's a general approach rather than too much specialist. That's what I'm talking about. So just a general. Key stations, useful hints and tips, interactive guidelines, how things are done differently in the UK, very important. The length of it, okay, very important. So how it provided some consistency in the months before the exam, and a sense of community and camaraderie. Yeah, I think that comes from comrades. So I had to Google it. I've never heard that term before, but a sense of, you know, a community. Yeah, so we're all in this together, and it just, you know, there's support. I really like that sort of term. It's straight to the point, detailed. It's easily approachable. You know, the friendly. The last one I liked as well is vast number of cases makes this course stand out. You can get the same amount of information from a 3 to 4 day intensive course. And it's been great to have a structured revision course which takes place over several months. I think being it spaced out is quite useful. And obviously, if you want to know more, there is lots of reviews on the website. Again, this I need to update. I think the last one was in London 24, so there's more updated feedback which I need to add, but I need to have the time for it. So lots of reviews online. You can just read all of that if you wish. Let's go through that one. I think this is important as well. Hope you can. So I'm really proud of my feedback. I wish I can sort of carry on with that sort of level, hopefully. Some things that people would wish to see improved. Basically, they summarized it in a few points. Basically, the time of the course. So again, it being 4 hours is too much from their opinion, which I kind of agree. It's too much, but it's really useful. We get a 5-minute break in between the OSCE and the Viva. We try to make it longer, but again, obviously, the longer it is, the more tricky it is. Someone has mentioned that, again, the discussions. So we try to limit the discussions, but, you know, the whole point about this is the discussions. Yeah. So from my experience, this is the best way to go. Yeah. And again, I've tried to limit the stations and make it a bit smaller, but I think the strong bit about this course is that it covers a vast amount of info. So that's why I tend to keep it the way it is. The duration, someone suggested that if it was only 2 hours, but then that would mean that we have to split it and make it on 2 days, which is impossible in my sort of job plan and timetable. It wouldn't work. So unless I go less than full time, which I'm not planning to in the near future. So the number of people, someone mentioned it's too many people. Again, I think I just feel too bad when someone asks me to join and then I tell them no. It's quite hard. You have to, yeah. I think I'm too nice. I think. Discussions are interesting, and then at the end we have to limit the time a bit to debate in a shorter time. So to be more structured, I think, but we're gradually improving that. And then something else I'm planning to do is to grade people as well. So on the side, I can just send them a feedback personally, just say, I think you've passed this sort of station, you've missed this, or you can get this, you know, or you haven't I don't think you will pass this sort of station because of this. So it's going to be more personalized. So future projections, some sort of thoughts in the future, hopefully. We're trying to reach out to more worldwide candidates, which is starting to show. We thought about employing more tutors, okay, and examiners globally. However, I will lose the autonomy. Yeah, so I'd like things done a certain way, and I know I'm doing my job well, thankfully. I'm not sure if others would. So I'm not sure when that's going to be, or if it's going to be, if I'm going to get other people to help. Lots of people have offered help, but I think at this point I'd be running this on my own, unless things change. So it's just the circumstances and the time that might change. Again, being a consultant, you don't have the time, so we'll see how it goes, but we'll see with time. The problem is, again, employing more people means that there is cost involved as well. So the course cost might rise. So that's something that we try to avoid if we can. So again, we're working on getting more videos. Okay, obviously not the same videos that you see in the exam, but very similar and very good quality videos. So we're expanding. We're sort of getting new equipment, cameras and slit lamp sort of stuff. So it's getting better. This is something that we are lacking at the moment because, again, it needs lots of support, it needs lots of preparation, is the mock exams on real patients, okay? It will happen, okay? But I need to think again, there's lots of factors that are involved which no one knows about, so and cost as well. So there is other thing, but that would be the thing that is missing. And we will get at some point, but I'm not sure when. But obviously it will be only one mock exam. It won't be more than that, and there was definitely going to be a cost involved. Okay, so that's why we're not that keen on it yet. But at some point, basically, I'm relying on people to practice on their own clinical time, in their own practice. You don't need an actual mock exam face to face, yeah, because you're doing that every week. We're doing that every week in the course, so you don't need someone to tell you what to do, what to say, because we're doing it already. But practicing on the patients, you should be doing that, whether you're doing the course or not, on your day-to-day basis, yeah. So virtual reality and artificial intelligence, that's an interesting one. I'm sure everyone would agree that that's the future, and we will be implementing all of those things in the course. So for example, virtual reality is, I'm not going to burn all the ideas, but it's basically trying to simulate the exam more. So again, face-to-face, wearing the VR sort of sets, and as if you're actually in the exam with a patient in front of you. There's lots of ideas floating in my mind, but it's how to implement it and the cost behind it. Artificial intelligence, again, and how you're assessed, how we mark you, the feedback, the marking system. It's lots of things that we can use using artificial intelligence and implement it in the course. There has been discussions about affiliating courses with the college. Some courses are affiliated, so there is an option of doing that, although I feel that I might be losing, again, the autonomy. So I'd like things done a certain way. I like to lead on what I'm doing. So this is on hold. Yeah, so it might be, who knows, in the future, but there is an option there's lots of opportunity. Yeah, let's say that. At the moment, we're not affiliated with the college, but maybe someday. Some people ask questions. I think that's the last bit. We discussed this. So if you're not doing the FRCOphth, you can still join the course. You are more than welcome. Lots of people are doing the FRCS and they're joining. They've passed. I think all of my FRCS candidates have passed the exam. I think it's easier than the FRCOphth, by the way. How many are allowed? Usually it's about 50. Okay, but if you're really, really keen, I don't mind it being 51 or 52. I don't mind. And remember, there's lots of flexibility, so you can join at the end of the course. I don't mind. and then you get what you've missed as recordings, yeah, which I don't mind. But there's usually flexibility. I cannot remember saying no to anyone. Okay, let's keep it to that. But if it's really getting busy and I get lots of negative feedback that I'm not getting the chance to participate or whatever, I might need to limit the number. Okay. I can't commit to the weekly attendance. What should I do? As I said, there is lots of other options. You can get it recorded. You can do the one-to-one mock exam later. You can sign up for the course, attend what you can. You don't have to attend the whole session. You can just leave, go in back. It's quite flexible. It's not that formal. And I would suggest at that point to do the one-to-one mock exam. I think you have to have this sort of chance and opportunity to practice in front of someone who can assess you. You can still join if if you're late, that's fine. As I said, you can get what you've missed as recordings. This is a very, very important question. Okay, in this age and era, everything can be recorded. Okay, I do record my sessions. I try to limit the option of downloading the course. Okay, I've recently heard that the course is being sold, okay, elsewhere for very cheap money. So that really, really bumped me out. Yeah. These things happen. Okay. So there is no way to prevent this. Okay. There are lots of apps and, encrypting sort of software just to avoid screenshots or whatever. The easiest thing that someone can do is put a camera and record record the screen. So there's no way to prevent it. Okay. But the only take home sort of benefit from this course is actually practicing in person. Okay. That's not something that you will get out of this course. Okay. So if you record, if you share these material with someone else, that should not happen. Okay. And you should do it yourself and you'll feel how it feels. Yeah. It's really disappointing, but the main trick is attending the course in person. Okay. It's not about the videos. Okay. It's about attending and participating and practicing. Okay. That's the whole key. If you are unsuccessful once, as I've said, you can spend the time with me separately, just for free. Okay. It's not paid for. Just to discuss your feedback, all right, and then go through the points and then work on what could be better. Yeah. So what should I do now if I purchase the course? So usually once you sign up, which I would expect people to be doing, I mean, already I think about 18 or 20 have signed up for the next upcoming course next week. I know that many people are waiting for the part 2 written results, which should have been today actually, but apparently it's delayed. So once it's out next week, I'm expecting lots of people to sign up, which is fine. We've still got time. We max it to 50. So I'm not expecting people to reach 50 within next week, but we will reach it at some point. Okay, that's what usually happens after a few weeks or so. People start to join. Anyway, once you sign up, you will get. I get a notification, and then I confirm with you, and then add you to the private group. And then if you've missed a few mocks, then I send it to you. So please, when you sign up, you have to write down your WhatsApp number, because if you don't have WhatsApp, I won't be able to add you to the course. Okay, so you have to be on WhatsApp and you have to contact me on WhatsApp to be able to know who you are. And thank you for those who filled out the form that I've sent out earlier, because there is lots of people there, and I will have to give priority to those who signed up earlier. Okay, lots of people have signed up already to the course, which is fine, but whoever showed interest, if it maxes out, I won't be able to get more people in. So the sooner you sign up, the better. Wait for your results. Do not sign up now. Wait for results, make sure that you've passed, and then you can sit the course. Okay. I think that's it. Okay. I think we spent lots of time. I think that's about 2 hours, which is a lot. These are the 2 WhatsApp groups. Please take a screenshot of them. The one on the left, this is the original one, the FRCOphth support which most people are on already, I hope, it's maxed out. So it's about 1,000 and somewhat people. It's maxed out, but there is a list of waiting people. So once people leave, I add more people. That's why I've made the one on the right, which is the ophthalmology support community. Again, whoever is who wants to add their colleagues, they can join both, but then just be mindful that the FRCOphth support one is full, and just join the community, which has got the 4 separate groups according to the exam they're sitting. Okay, so please join the particular exam that you're interested in. There's lots of contacts there, website, email addresses. This is the WhatsApp particular to the course. This is not my personal one, but you will have my personal one, I hope. I don't mind you using either. And you can find us on all this various social media. If anyone has got any questions, let me know. I'd be more than happy to answer them. Has anyone got any questions at this point? I know I've talked a lot. Lots of chat. No questions. That's excellent. That's perfect. Okay. I will upload this on YouTube, okay? And feel free to get in touch if you've got any questions, any any inquiries about the course or the exam, whatever. Let me know, and then I'll be more than happy to chat. Okay. Thanks everyone, and good luck. Thank you very much. Have a good weekend.
Thank you, Mustafa.
No worries. Thank you, Bia. Thank you.